we're all ready to go.
This much pain is normal. It's all in your head. You're overreacting. When they're seeking medical help, there's many ways that women are told they're being overly dramatic. But why?
डॉक्टर, मुझे एनेस्थीसिया दे दीजिए। मैं बेहोश होना चाहती हूँ।
Relax, Mrs. Batra. मैं ये हजारों बार कर चुका. Relax.
Hippocrates, who's regarded as the father of modern medicine, promoted the theory of a wandering womb, which linked all of women's mental and physical suffering to a uterus that just wouldn't stay still. This condition, which he called hysteria, was a diagnosis that persisted for thousands of years whenever women sought help for physical pain that male doctors just couldn't understand. Though hysteria was completely delegitimized as a diagnosis in 1980, the idea that women exaggerate their pain or their physical pain is all in their head is still strong. Even today, when most medical textbooks show case histories of physical pain caused by mental or emotional factors, the subjects are female. But where does this stereotype of women exaggerating physical pain come from? A pioneering study by medical anthropologists in the 90s found that men's pain was prioritized because of the notion that men complain less and so their pain must be real. At the same time, women's pain is dismissed due to the stereotype that women exaggerate and are inaccurate.
एक दिन किसी भी छोटे बात पे नाराज हो जाती है और फिर अचानक एक दिन ठीक हो जाती है. You know, लड़ती है तो लड़ते रहती है और फिर ठीक रहती है तो ठीक रहती है. You see the pattern? It's like a
मिस्टर शर्मा, इस हिसाब से तो दुनिया की सारी औरतें बाइपोलर हुई.
Another important factor which has led us to ignore women's pain is the assumption that bearing some amount of pain is just a natural, normal part of being a woman. This is visible in our attitudes towards pain management during childbirth. Historically, there was a strong societal objection to the use of painkillers during childbirth in many places around the world. In many parts of India today, it is still considered a taboo. But here's the thing. Not only do women experience pain which men may never experience because of menstruation and childbirth, but studies have shown that conditions which cause chronic pain like headaches or arthritis are actually more common in women. We're only just beginning to understand how men and women experience pain differently because up until the 1990s, medical research was conducted mainly on male bodies, reflecting the assumption that male and female bodies are exactly the same. In 1993, the US passed a legislation mandating the inclusion of women subjects in medical research, and yet around the world, women continue to be underrepresented in clinical studies. And this has resulted in a range of negative consequences, from the misdiagnosis of heart attacks in women to an average of a 7-year delay in diagnosing endometriosis. We're often taught that the sciences, especially medical sciences, are unquestionable, objective, rational, and free of bias. But we forget that these sciences are developed and honed by human beings who are subject to the same social biases and patriarchal conditioning that teaches us that women are crazy, hysterical, or overreacting. So maybe we need to question the frameworks within which science develops. It's only when we recognize these biases in our sciences that we can ask these questions again from fresh and original perspectives and develop a medical system that is equal and accessible in every way. That was it for this latest video in the Overthinking It series. If you like overthinking with us, please don't forget to like, share, subscribe to our channel, and don't forget to hit that bell icon so you stay updated.